right, thanks for staying with us. I did remind you that the International Central Gospel Church did a big contribution back in 2019 towards mental health. They're on course again this year, and Reverend Albert Okran is with ICGC. He's joined us for a conversation. Also joining us via phone, Dr. Caroline Emisa, Deputy CEO of Mental Health Authority. Let me start with you, Reverend Albert Okran. Thank you very much for coming. Good morning to you. So you're working tomorrow. You're contributing to mental health, something that you've done before. And then you're also celebrating frontline workers. Why is the church doing this at this time?
Thanks for having us, Mavia. You're looking very sporty, I must say, today.
Thank you.
Supporting my favorite team. So, March is a health and fitness month for us at ICGC. And so we come up with various events to commemorate that health and fitness month. And the key highlight is Life Walk, which allows us to, we encourage individual health and fitness as part of our mission as a church. But in Life Walk, we come together in our thousands and do a typical 12-kilometer walk to remind us of the importance of health and fitness. And interestingly, that's also the opportunity to raise funds for one of our chosen charities. And over the years, our biggest beneficiary has been the Children's Cancer Unit, which we've adopted for the past 10 years and still support. But additionally, Life Walk has been shifted to focus on mental health in Ghana. And the reason is simple, Mavi. We believe that it's an underserved area in the healthcare gamut. Pastor Tabel has always said that people who suffer from mental health, we used to typically see mental health as mental illness. But we find out that there are several people that we love around us who have issues one way or another with mental health. 2 out of 5 people have one issue or another. And the COVID-19 pandemic, with the restrictions and change of lifestyles, have further exacerbated mental health issues. So last 2 years, we were able to support them with 3, what they call the miracle machines, the ECM machines, for each of the mental hospitals in Ghana to the value of about 200,000 Ghana cedis. And they found it extremely helpful for extending mental health care. This year, we approached them again and found out what they will need most at this time, bearing in mind the fight against COVID. And they highlighted, not surprisingly, PPEs, and particularly face masks.
Oh, really?
Yes, they felt that that would help them to take care of patients, administrators, because really, everyone in the value chain must be protected. Sometimes, in the words of Professor Say, sometimes you're thinking both of the healthcare giver as well as the patient, and they both must be safe. And so in that regard, Dr. Table decided that we should go the full length to support not just one hospital, but as many of them across the country as possible. So in tomorrow's Life Walk, we are presenting 105,000 face masks to mental health institutions across the country as our contribution to mental health care in Ghana. And then on Sunday, we gather to thank all health workers who have in one way or another contributed in the fight against COVID, especially remembering also those who may have lost their lives, unfortunately, in the course of protecting all of us. And the church feels that doing this is a way of telling them your sacrifice was not in vain, and their families would feel appreciated for the sacrifice of their loved ones.
Great. Let me engage Dr. Caroline Emisa, Deputy CEO of Mental Health Authority. And we're just putting pictures of the 2019 Live Walk. I know that we missed it. We missed the gathering and doing it together, but we're going virtual. Reverend Okran will tell us how it's going to go down tomorrow. But Dr. Caroline Emisa, I'm grateful that you could join us for a conversation. Just briefly tell us how the psychiatric hospitals are faring these days.
Okay, so thank you very much. Good morning. And good morning to Reverend Okran and your listeners. Yes, I'm happy to be on this show. I'm grateful that ICGC is doing all they are doing to support mental health. Currently, yes, like he rightly said, and as you know, our mental health facilities have always been cash-strapped. Why do I say that? Because mental health care in Ghana is free. And it was rightly done so because we realized that persons who suffer from mental illness usually are not able to be productive. That is, they are not able to go back to work to make money or to be remunerated, to be able to take care of themselves because of the nature of the disease condition. So it happened that at the time the law was being passed, it was thought to make mental health services free, and government was taking care of all, salaries, goods and services, infrastructure, and what have you. But we all know that the population has increased. Other sectors have come up. Now we haven't moved from, but non-communicable diseases have also become a challenge to add up to our communicable diseases, which were the key or major things in the past. So you realize that government alone cannot do this. And so the funding for mental health services in the country, even though has increased, I'd have to commend government for that. It has increased remarkably over the years, but it's still not enough. And yes, we talk about our hospitals, but when you move out of the hospitals, there are still mental health services that are provided in the communities. That we haven't been able to do too much for. But even looking at just the 3 psychiatric hospitals, they need support for logistical services, what have you. So I think that persons and organizations like ICGC have taken the right direction and are doing the right thing in looking at support for our institutions. And I'll say that with COVID, we really were cash-strapped, like I've always said, because we don't have medicines. We have to buy medicines, first of all, to take care of the patients we have. And then talk about protective equipment. Yes, government distributed some protective equipment to the regions, and we were lucky to get some from the COVID coordinating team as well. But it's not enough. So there are nurses on different shifts from morning, afternoon, and night, and you have to wear masks, you have to wear other protective equipment, and be changing them, sanitizing, washing your hands, and all that. So it became actually a burden because we take care of our patients just like any other hospitals do. Every 4 hours, you need to go check on your patients, what's happening with them, has anything changed significantly, what do you have to do with them. So the little money we had, we could buy some PPEs, but they were not enough. We actually reached out to government. They supported us with some, but I believe that the hospital could do with some more, and we are grateful that ICGC is looking at supporting us in that regard. And probably I must say that it may not just be face masks. Maybe we may need some liquid soaps and sanitizers and what have you to do the same, adhere to the protocols that we have been asked to.
Okay, fantastic. I like the fact that you're putting your needs out there. But just finally with you, they presented some therapy machines some 2 years ago. How helpful has the machines been?
Yes, so the ECT machines are, good machines that are used to treat patients at various levels of their care. Whilst you are being managed, if, for instance, the medicines are not doing as well as we expect it to do within a time, so you are upset, and then we would have to come in with some of these machines. It produces some electrical activity on the brain, which helps to stimulate your brain activity. For some people, especially who are depressed, etc., sometimes we need these machines to stimulate them, to bring them out of the state in which they are. It's a therapy that when you need it and it's used on you, it really has great effect. It's been proved elsewhere. And the hospitals, yes, are finding ways of using it. If I say they are finding ways, some of them need anesthetic machines together with it because they have to put the patient to sleep a bit, so that they don't feel the activity so much. And the hospitals are working with it, I would say, yes.
All right.
Use it.
Okay, well, we'll follow up again after tomorrow's exercise. Dr. Caroline Emisa, I thank you very much for your time. She's the
Thank you too.
Great. She's the Deputy CEO of the Mental Health Authority. So we're thankful that, you contribute to an area where largely is neglected. I mean, once in a while, we will engage them as media, for instance, but the everyday stories that they have to battle with. So thank you. They said, are you adding some soaps?
Let me celebrate the effort of Professor Say, Dr. Emisa, and all the hardworking people at the Mental Health Authority and institutions across the country. What they do is amazing, and they can be assured that, considering the orientation of Pastor Tabo, we will stay with them and continue to support them, and that must be comforting for them.
Yeah. Well, for us as well, because you never know, I could find myself needing mental health care tomorrow.
I believe that we all need help in that area one way or another. But tomorrow, talking about tomorrow, Bobby,
virtual walk.
So last year, just when we were set, COVID struck, and last minute we had to put out a press release, and people were so disappointed that life work had to be called off because people look forward to it. Now we are not yet out of the woods in terms of the risk of large gatherings and super risky infections that come with that. And so the church leadership thought in its wisdom that we should not miss out on the significance and symbolism of the life walk. And so we should walk, but not in the large numbers that we've become used to. So the whole idea of virtual walk is that tomorrow, just pick out your phone, and at 5:30 a.m., which is the typical takeoff time, go to Facebook, YouTube at Mensaltable, which many people have bookmarked anyway, subscribed to anyway, and then you will see the walk being virtually simulated. You will see footages from previous years, simulated walks. You will see the narrator. You will get the kilometric signs. You've done 1 kilometer so far.
Oh.
It will guide you on the walk as if you were walking with people.
Okay.
And the exciting thing about it, Mavi, is that every individual can, in their own life walk t-shirt or whatever t-shirt they are wearing or whatever gym clothes they are wearing, just take their own picture and post it on social media and hashtag we are ICGC. And we will just get to see the various people walking in their various places. We say, listen, you can walk in your compound, in your locality, in a preferred place, but just walk.
Are you doing 12 kilometers individually?
So the standard is 12 kilometers, but we also are mindful that people, for various reasons, may choose to do 1, 3, 6, or 9, but walk. That's the whole idea. And the good thing about virtual walk, you also could decide that, listen, I wouldn't walk at dawn. Considering my area, I'd rather walk in the cool of the afternoon, or I'm catching up with some friends at 11 and you're doing it together. And you can still watch the recording on your phone and still enjoy it. So choose your own location, choose your own distance, and choose your own time, but walk.
Is Pastor to be walking tomorrow?
He definitely will be, and you will see him, if you hashtag my ICGC, you will see him walking along with Lady Joy, and they're looking forward to it as well. And then just before we sign off, maybe Mama V, because it's a sponsored walk, we would like to encourage people. People like to own their own contribution to mental health. So the church has made a commitment already. But individuals want to believe that, listen, I bought 1 KN95 for mental health, or I bought a box myself. So we don't want to deny people that opportunity. So if you will indulge me for just a minute, I would like to encourage our viewers, just dial *773*0#. *773*0#, and then choose give. When you choose give, you will see a dedicated life work there. Just click on life work.
Wait, why don't I do it?
Oh, that would be lovely.
So you
dial *773*0#. There you go.
Okay.
Once you click, it will show you the various prompts, and you will see give. So
it's given, check-in, booking, after call, and price.
So click on given.
Okay. And I'm waiting for the options. Again, given menu. Give, make a pledge, given history. If I want to give,
so go down.
Continue to give. Do I still do give?
Go then, click on 0.
Okay. So we're talking about Life Walk tomorrow. We're talking about how you can contribute to this certainly good cause with a contribution from the ICGC. Okay, so it says main menu Christ Temple, Mama View Sabwaji, given check-in.
Oh, so you're there already.
But I'm a member of the church.
I know, but it's important to mention that
Oh, so you might not find your name if you're not.
No, if you are not, you won't find your name, but you still can go ahead and choose Life Walk and give.
Oh, okay. Oh, okay. Well, I haven't been to ICGC like in a very long time.
I'll tell Pastor that I told you live on air that you shouldn't miss it out.
So this is actually pretty simple, and I'm excited. So here are the options: church offering, Life Walk. So I just go to Life Walk,
so
right?
Go to Life Walk and give plenty.
Okay. How much
is,
should I give?
The good thing is, okay, so let's say, just so we don't scare our viewers, so you give 100. Let's make it 50.
I give 500.
Oh,
yeah.
Isn't that wonderful?
Because I haven't been to church in a long time.
I tell you what, you should come here every day. We'll raise enough money to buy the mask. And the good thing is that just by telling me how much you're giving, I can calculate how many boxes of KN95 you are buying. Can you imagine?
Yeah.
You actually are buying 10 boxes.
Oh, really?
Yes, 10 boxes of KN95 masks.
Wow. Okay, so let me finish the process.
That's beautiful.
Let me finish the process. Please give the hashtag again so that our viewers, if you're watching right now,
so if you're watching
that's my donation, just so you know I actually donated and it wasn't just a show.
I see it live. So *773*0#, or if you are on Express Pay, just go to Express Pay and then look for Christ Temple and look for Life Walk and then give. Or you can download the My ICGC app, click on Give and click on Life Walk. But for many people, the easiest route is to just dial *773*0#. Choose Give and choose Life Walk. It's a very fulfilling feeling that your contribution, no matter how small, can allow somebody to be helped. And I want to say thank you to yourself, to the multimedia team for being such a strong support to ICGC in everything that we do. We truly celebrate your team here for the support.
Well, some of us are members, so we're just doing our duty. But tell me just finally how you're celebrating the frontline workers.
So on Sunday, every member of ICGC who's a health worker is encouraged to come to work to church in their uniforms. In Christ Temple, we are saying that you come for the first service at 7:30, but every ICGC church tomorrow is asking health workers to come to church in their uniform. There will be reserved seats for them. There will be a special citation signed by the General Overseer that will be read to them. There will be prayer for them. The whole church will celebrate them. And there will be other things being done that are add-ons.
Okay.
But I believe that every health worker who comes to church tomorrow will go home feeling that the duty of care, the sacrifice they make for our nation is not in vain.
Is this Sunday or Saturday?
Sunday.
Okay.
Sunday, the 28th.
Sunday first service.
At first service at Christ Temple and at ICGC churches worldwide.
Okay.
Every one of them will have the same celebration for our health workers.
Wow. This is incredible.
Thank you.
Yeah, so thank you for what the church is doing as well in encouraging all of us and helping us. Sometimes people want to contribute, but you see, they don't know how, and they feel that what they have is too little to make a big impact. So as we all bring it together, it will help, solve a bigger problem.
Absolutely.
So we thank you. Do we know how much you're aiming at contributing? Because the last time in 2019, I think you gave up to 200,000?
So the 2019 contribution came up to 200,000 cedis. Our identification of face masks as the need, we valued the 105,000 face masks at 150,000 Ghana cedis.
Okay.
So that is the contribution for this year, in kind, in the form of face masks.
All right. Thank you very much for your time here on the show.
Thank you, Mavi.
All right. Stay with us. We have plenty more conversations coming up here on the AM Show.